report from the Alzheimer's Association shows the number of people diagnosed with the disease is growing.
And medical professionals in our area and beyond say it's weighing heavily on staffing. Mackenzie Mislin joins us in the studio with more on today's report. Mackenzie.
Yes, Adam and Teresa, the report shows the number of Alzheimer's patients to grow from 62 million people to 88 million people by 2050. Dr. Podgorski at WROC says with the ongoing staffing shortages, there will never be enough caregivers for these patients.
Alzheimer's disease affects an individual's memory and damages the brain. Because it can cause the patient to forget everyday functions, caregivers like Nate Brown Jr. must exert much of their energy into helping patients remember.
When your loved one don't remember you and throw food at you and all the things that they never did to you before in your entire life, that's kind of stressful because you got to kind of get, not only to get used to that, but you got to understand that's the disease. But my mom was a G, straight like that. So to see her like this, it's gut-wrenching.
59% of unpaid caregivers report emotional stress due to caring for an Alzheimer's patient. But Dr. Podgorski with WROC says the workforce changes are to blame as well.
I think what has happened since is that during the pandemic, so many people who were in the workforce decided they didn't want to do this work anymore. And that's part of the problem, is that we can't recruit the specialists, but then our current healthcare system doesn't pay for all those wraparound services.
And Teresa Gelbier with the Alzheimer's Association says if patients increase and caregivers don't, there will always be staffing shortages.
There are less than 570 geriatricians in New York today, and if we continue to see the trajectory increase of this disease impact and those diagnosed within the next 20 years, we need to see triple that number of geriatricians.
Brown says the only resolution is to either find a cure for the disease or pay more for these positions in the meantime.
You're not paying them what they're worth. And taking care of somebody, do you know what those ladies do for my mom? She can't do anything, so think about that. 24 hours a day.
Dr. Podgorski adds places like Alzheimer's Association and Lifespan are struggling as well because when they want to connect people to services, there is no one to connect them to because of the shortage.